Thank you, Mr. Chairman. We can probably all agree that our current health care system often fails to deliver high-quality care and rewards inefficiency. I support policies that will create real incentives for health care providers to improve the quality of care they provide to their patients. I'm deeply skeptical, however, of any government initiative that claims it can save 60,000 lives and $35 billion over the next 3 years by improving the quality of care provided to patients. This is especially true for a proposal that relies on voluntary grants to hospitals and other providers to encourage them to modify long-standing behaviors which are often encouraged by current government payment systems. The new Partnership for Patients will spend $1 billion to fund new research at the Center for Innovation at CMS and provide grants to hospitals and other interested parties to reduce the number of patients readmitted to hospitals to treat the same or related conditions. The crux of Partnership Initiative is providing grant monies to encourage providers to do the very things they should already be doing for their patients. While this may be politically attractive because it wins the support of all the stakeholders who will receive grant funds, I see very little evidence that it will actually change the fundamental problems that exist in the current system. Unfortunately, the federal government does not have a very good track record in implementing such reforms. The agency charged with carrying out these policies, the Centers for Medicare and Medicaid Services, CMS, has a long record of missed deadlines and failures to implement policies that were intended to reduce Medicare spending. Further, we've seen little evidence that the program will have rigorous standards for accountability, which would create both incentives and penalties for providers who will fail to fundamentally improve their performance. The administration's witness today, Dr. Carolyn Clancy, has also seen firsthand the challenges of getting providers to modify their clinical practices. Her agency has been publishing best practices guidelines for years, but efforts to fundamentally transform systems of care to promote quality and lower cost remain almost an aspirational goal. I'm not alone in expressing skepticism about the effectiveness of these types of proposals. In March 11, 2010, letter to Senate Majority Leader Reid, the Congressional Budget Office estimated the direct revenue and spending effects of proposals to develop new patient care models, including the new CMS Innovation Center and the Community-Based Care Transition Program, would produce a net cost to the government of $200 million over 5 years. In short, according to the Congressional Budget Office, the types of proposals we're discussing today will not produce any savings for the foreseeable future. On the contrary, they will have a net cost. I believe that health care providers like Dr. Charles and Dr. Mailer, who will testify at our second panel, should be applauded for their efforts to promote quality and improve care, even without these incentives. I look forward to learning more about the specific policies and practices they've implemented to improve the care they provide. Hopefully their testimony can help inform us about the types of actions the government could take that will actually encourage providers to make the changes that are necessary to really improve the care they provide their patients. Thank you, Mr. Chairman.
Thank you, Senator Enzi. And I'd like to yield also for an opening statement by Senator Mikulski, who was the leader of our effort. And when we did the Affordable Care Act, we broke up into teams, and she led